British regulators have authorized a second coronavirus vaccine as a surge in infections threatens to swamp hospitals in the country. AstraZeneca's shot will begin rolling out in the country starting January 4th. But this vaccine distribution will look different from Pfizer's just 3 weeks ago. The British government will prioritize getting as many people vaccinated as possible with a single dose of the shot. Meanwhile, in the U.S., Colorado health officials have identified the first case of a new coronavirus variant first discovered in the U.K. According to officials, the man is in his 20s and has no recent travel history. Scientists worry the speed of the variant's spread could lead to more infections, as the country is already seeing a surge in cases and deaths. Meg Oliver reports from New York City.
Going to have an increase superimposed upon that surge, which could make January even worse than December.
They're all positive.
A worse month of coronavirus is hard to imagine, especially in places like Los Angeles County. Daily deaths there are up 600% since November. And with ICUs completely full, the state extended strict stay-at-home orders on the Southern California region. Some hospitals are treating patients in ambulances and cafeterias. At Martin Luther King Jr. Community Hospital, they've resorted to putting beds in the gift shop.
We're a 131-bed hospital that started the day with 224 patients in the hospital.
With the virus raging out of control, many Americans are desperate to get the vaccine, and the process so far has been slow.
There is absolutely no reason we cannot get vaccines out faster to the American people.
Dr. Ashish Jha is the dean of Brown University School of Public Health.
There really hasn't been much investment from the federal side in helping states to get the vaccines into people's arms. States don't have the dollars and they don't have the resources to just figure all of this stuff out on their own.
In Florida, thousands of seniors lined up for their shot at the COVID vaccine, some waiting overnight.
It's kind of like a mob scene of senior citizens.
Retired school teacher Wayne Frangello spent hours waiting for information from local officials about vaccine registration that he says never came. He finally booked a slot 2 weeks from now.
It wasn't on Twitter. It wasn't on Facebook. It wasn't on the news. If you're not good at sniffing and scurrying, you're just out of luck.
Dr. Jha told us the current vaccination rate could take years for us to reach herd immunity, but both he and Dr. Fauci believe the process will eventually speed up. Yesterday, Health and Human Services announced they allocated nearly 20 million doses for distribution, but most of those have not been delivered and very few have actually been administered. Jamie?
Meg, thank you. For more on this, let's bring in Dr. Shoshana Ungerleider. She's an internal medicine physician at California Pacific Medical Center. Thank you so much for getting up so early this morning for us. We appreciate it.
Thank you for having me, Jamie.
So we have to ask, should states be taking any additional measures to protect against this new variant everybody's talking about of the coronavirus that's now been detected in Colorado, or is it too little too late?
Well, Jamie, I think the news that this, in fact, is here in the U.S. is concerning, but not at all surprising. It's important to point out that all viruses mutate and change over time. This is normal and expected. I think the concerning part about this variant is that it has a handful of mutations in its genetic code, and it looks as though this makes the virus spread more easily. And this is already a highly contagious virus. It does not appear to lead to more death, but if more people are infected with the coronavirus and require hospitalization, that's where we're going to run into huge problems, given that our healthcare system is already completely overwhelmed. So first and foremost, I think states need to understand the degree of spread of this variant. In order for us to adjust strategies to cope, we need to first be looking for it and then testing effectively, which we aren't yet doing. The good news is we know how to stop the spread of this virus with our behavior. We just need to keep doing that.
We've been preaching that for a while, but when you look at what's happened over the holiday season, it's a little scary to think about surge upon surge, as Dr. Fauci was talking about, and now this new variant being popping up places. So I do want to ask as well, we were talking about the rollout of the Oxford-AstraZeneca vaccine beginning next week. The UK's health secretary says the country could be out of the pandemic by the spring. How long could it be until the vaccine is authorized here in the United States? Because I think a lot of people are looking at that going, wow, that's a great timeline.
Yeah, this is good news out of the UK. I think the more options that the world has for safe and effective vaccines against COVID, the better, right? The big differences here are that this particular vaccine uses an adenovirus to help prime the immune system to fight the virus, and it's a lot cheaper than other vaccines and can be shipped and stored in normal refrigerators for up to 6 months. So in terms of distribution, that's a really good thing. It's not clear exactly what's going to happen in the U.S. with this vaccine. When the FDA is going to be reviewing data from a separate clinical trial that's being conducted for this particular vaccine, but possibly by early next year. That said, what we're already seeing in terms of issues with the current 2 vaccines being rolled out doesn't lead me to believe that we're on track to be reaching herd immunity anytime soon, unfortunately.
That is unfortunate. Another unfortunate thing playing out right now, I've been watching very closely. Obviously, I live usually in Los Angeles County. I'm here in New York to fill in. But hospitalizations in the western part of the U.S. and the southern part of the U.S. are again climbing. According to the Tracking Project, the South accounts for nearly 40% now of the more than 124,000 Americans currently hospitalized. Why are these regions seeing such a significant spike?
Yeah, Jamie, I'm so concerned about this. The state of California, where I also live, is in such a bad spot. And it's not clear exactly why this is happening, given how strict California in particular has been with lockdowns. I think that because we didn't get hit very hard early on, Californians in particular may have had a false sense of security. People started to let their guard down. LA County, for example, as you know, has a population of more than 10 million people, with high rates of poverty and homelessness, huge numbers of essential workers in some of the densest neighborhoods in the nation. So all those kinds of things lead to potential for increased spread of the virus, but we don't know for sure. And then many people have traveled and gathered together for Thanksgiving and for Christmas. So lots of reasons for this huge surge in California and across the country. And as you know, many hospitals have already run out of ICU beds completely, which means that all medical care is suffering. So it's a really dire situation throughout much of the country.
Yeah, I still don't know that people get that when ICU beds are gone, whether you're in a car accident or you break a bone or you have some other type of health issue, there's no bed.
That's right. I've heard stories from my colleagues down in Los Angeles that people with heart attacks and strokes are literally being turned away from the hospital because there is just no room.
The other problem in Southern California we've been talking about, oxygen supply shortages turning up at hospitals are causing further complications to an already overwhelmed medical system that we're talking about right now. With cases likely rising in the coming weeks, as we're saying, due to holiday travel and gatherings, how devastating would it be for a hospital to simply run out of its supply?
I mean, Jamie, as you know, this virus impacts the respiratory system. So to run out of such an essential tool to treat patients would be devastating. People can only receive high quality medical care if there's enough supplies and hands and beds to go around. The situation on the ground is really just terrible. And if this new variant of the virus does spread more quickly, as it appears to, and more people in the coming months require medical care, we're going to see a crisis unlike anyone can imagine. The good news is, though, that we know how to stop this virus by wearing masks, by refraining from gathering with others that you don't live with, especially indoors, and washing our hands. And we just need everyone to do this.
We keep repeating it, but it is just so important. Some other numbers that I thought were interesting. A study by the CDC found that of the more than 106,000 coronavirus patients who were initially hospitalized between March and July, 1 in 11 were readmitted within 2 months of being discharged. 1.6% of patients were readmitted more than one time. What complications are causing these patients to be hospitalized, and who's more likely to return to the hospital later?
Yeah, that's right, Jamie. This is really interesting information. Based on this analysis, looking at folks 1 in 11 people who survived COVID, right, had to come back to the hospital within 2 months. Now, these are people who were largely older adults, so over 65, had underlying chronic medical problems, and more often happened among patients who were discharged from the hospital to a skilled nursing facility. But certainly, younger people are impacted long-term as well. Many of all ages are facing long-term issues with their lungs, with their heart, blood vessels, and even mental health. I think that the takeaway here is that surviving COVID-19 does not mean that you'll have a symptom-free life, and we're just starting to understand the long-term impacts of this illness.
Oh, just one more thing to think about. Before I let you go, I do have to say we've become friends through mutual friends. I usually see you over Zoom. It's nice to see you on a different screen.
So nice to see you too. Take care and stay safe out there.
You too. Dr. Shoshana Ungerleider, thank you so much for being with us. We appreciate it.
Thank you.